name is Czarnik, and I'm an emergency physician practicing in Baltimore, Maryland. People always ask me, what's it like to be an ER doctor? And I think that that's a hard question to answer. But people also want to know what goes on behind the scenes in an emergency department, especially when it pertains to their own care and the experiences that they have when they come into the ED. So I think one of the most common questions that I get is, why are people going in front of me when I've been waiting for 2 or 3 hours to be seen? And what people don't really realize about the emergency department is that with the healthcare situation in our country at this time, ER facilities are taking care of more and more people for their primary care complaints. And what happens is that an emergency department is really set up to be a place where you come when you have a life threat. And because we are taking care of more and more people for primary care concerns, this is creating a really big weight and a backup in the system. And while we're always happy to take care of people for any complaint that they present with, I think it really starts to cause a problem because people don't understand what our priorities are. And really what the priority is to take care of the patients with the most life-threatening illnesses when they come in. So a patient with chest pain may come in and be taken straight to the back if we feel that they might be having a heart attack, and the patient that's been waiting for 2 or 3 hours for a complaint like a laceration or an earache sits and waits longer. And it is really frustrating, but I think that the message that we want to get out to people is that we want to take care of you and we want to do it as quickly as we can, but we have to intervene with the patients who are really sick at the moment that they come in. And it's not that we're ignoring everyone else. We really do want to take care of everyone that we see. One of the other things that I think is really important to talk about is how do you interact with someone when you have a patient who's really upset about the care that they've gotten or the wait that they've had. And one of the best pieces of advice that I ever got in my practice is that you just need to listen. So many times I've had patients who are very upset with their wait or the way that things have gone, and I really feel that if a doctor just sits back and listens to a patient when they're upset, that the relationship can be repaired and that you can really move forward and do a good job in taking care of them. And it's worked for me, and I think it's generalizable to the rest of your life as well. Finally, I'd like to just talk about what it's like day in and day out to do this job, because I think people have a really skewed perception of what being an emergency physician is about from TV shows that we all know. And I would say that a lot of it is excitement mixed with some fear, and I think the most rewarding thing for me is that you can intervene at someone's most critical moment, whether it be a car accident or a heart attack, and you can actually make a difference and save a life. It doesn't happen every day, but when it does, it makes my job really worthwhile, and it humbles me that I've been given the privilege to do this as a career. And I think that it makes it worth going to work every day despite the little frustrations that you have. It's a really fun job. You're on your feet all day long, you're running around, you never sit down. A lot of times you're doing, mundane things, but then, every once in a while you get a patient who's very sick and you actually make a difference, and that's what makes my job worth doing every day.